This is our presentation called Drug Treatment by Fernando, Jesse, and myself, Jose.
What is drug addiction? Drug addiction has been characterized as a chronic brain disease that causes compulsive or uncontrollable drug seeking and continued use even though it has negative harmful consequences and causes changes in the brain. Drug addiction is a relapsing disease, and addiction is a disease that affects both the behavior and brain of a person.
Drug offender statistics. Drug offense sentences are critical in the United States since it is a noteworthy consequence of the troubled prison population since 1980. The percentage of state prisoners incarcerated for a drug offense almost quadrupled from 6% in 1980 to 23% in 1996, and for federal offenders 25% in 1980 to 60% in 1996. This drastic increase effect of about 3/4 of the total federal inmate population and 1/3 increase in the state inmates during these 16 years. How drugs relate to crime. In 1997, half of the state inmates and 1/3 of federal prisoners reported committing their current offense under the influence of alcohol or drugs, and 1 in 6 of both reported committing their current offense to obtain money for drugs. In 2002, about 1/4 of convicted drug offenders in local jails had committed their crimes to get money for drugs. In 2004, 17% of state prisoners and 18% of federal inmates said they committed their current offense to obtain money for drugs. And in 2005, 30 states released state prisoners, and within 5 years of release, 76.9% of drug offenders were arrested for a new crime. Drug use in prison. The use of drugs is very common worldwide and a problem in prisons. In a study of 350 women serving a prison sentence in Brazil for violent crimes, many reported being involved in criminal activities since they were young. With alcohol and drug-related, this was associated with drug use in prison, in which 35 women had reported using illicit drugs while in penitentiary. In addition, more than half of men use drugs while in Brazilian prisons. According to a 2002 survey of men in the United States, 68% were found to be dependent on drugs or alcohol or abusing them. This becomes a problem once they arrive to prison because they are addicted to drugs and can no longer get easily in prison, so they have to purchase drugs from other inmates.
Drug offenders prison population. Drug offenders in prison increased 63% as of 2012. This increase would make prison populations be made up of 52% drug offenders by the year 2012. The statistics of these numbers is recorded from 1998 to 2012. That means that more than half of the prison population is made up of drug offenders. And of those half, 99.5% of drug offenders serve time for drug trafficking. The types of drug users in prisons vary. 54% of drug users in prisons were addicted to powder or crack cocaine. 24% were addicted to methamphetamine. 12% marijuana. And for marijuana, you must include that laws have changed in the past years. 6% heroin users, and the 3% are other. And in the other, that includes LSD, MMDA, and prescription drugs or over-the-counter. Drug rehabilitation. There are many factors that can determine the success or failure rates of drug users. For example, a legal pressure can be a huge influencer on determining whether someone gets out of drug abuse. For example, offenders charged with felony-level offenses, which is 71%, had a higher success rate than those charged with misdemeanor-level offenses, made up of 52%. This could be because the felony charges were more extreme and the criminals were afraid of losing more, while misdemeanors weren't worried about losing as much, so therefore they could care less. Another factor that was huge in drug rehabilitation was employment. Those who were full-time employed had 75% success rate of their drug treatment programs, compared to an unemployed at 51% success rate. This was taken from a sample size of the Hidalgo County made up of 12,385. Drug treatment programs. There are many programs that can help drug abusers. The first one includes outpatient treatment. This kind of treatment is delivered from doctors' offices or a clinical setting. This involves less severe drug abusers. They receive drug education and sober skills training. The next would be intensive outpatient treatment / day treatment programs. These are somewhat more intensive, but very similar to outpatient treatment users. The intensive outpatient treatment users receive a bit more frequent administration to help with their problems. Next is residential treatment. This is for more severe abusers. These drug abusers receive round-the-clock attention, and they are placed on a 24 care surveillance. They also receive group counseling and are placed in situations and environments to help them succeed with other people who are in similar predicaments of drug abuse, so that way they can cope the problems together. The last would be intensive inpatient hospitalization. This is full-time supervision, and this is for severe substance abusers who have received deteriorated medical / psychiatric state of mind.
For the next 5 slides, it's slightly identical to what Jesse said, but for long-term residential treatment, it takes care of individuals for 24 hours a day. Its best-known residential treatment model is therapeutic community. Its planned duration of stay usually varies from 6 to 12 months. Its structure is occasionally includes confrontational moments, includes activities designed to help residents examine damaging beliefs, self-concepts, destructive patterns, or behavior, interaction with others as well. Some research study shows that treatment can be altered to treat others with special needs, homeless people, people with severe mental disorders, people in the criminal justice system, and many more. For short-term residential treatment, it is a 12-step plan for people to follow. It was originally designed for alcohol issues, but fun fact is that when cocaine started to rise in the mid-1980s, it began to treat other substances as well. It was originally intended for a 3 to 6 week hospital-based inpatient phase, then continued with an outpatient therapy and participation in a self-help group. So an example of this is Alcohol Anonymous, where they gather around and share. It is important to be interactive with outpatient treatment programs and / or aftercare programs. It also helps reduce the risk of relapse once a patient leaves the residential setting. Outpatient treatment. You're probably wondering what it is, but here are some facts to tell you about it. It varies in the types and intensity of services offered. It is cheaper than residential or inpatient treatment. It may offer little more than drug education. It also includes group counseling, which may be an important factor. Also, some programs may be designed to treat patients with medical or other mental health problems in addition to their drug disorders. Individualized drug counseling does not only focus on reducing or stopping illicit drug or drug consumption. It also addresses related areas of impaired functions like employment status, illegal activity, family or social relations, content and structure of the person's recovery. It also increases persons' coping strategies and tools to abstain from drug use and maintain abstinence. It encourages 12-step participation at least 1 or 2 times per week, so it could be beneficial enough for them. It also allows referrals for supplemental medical, psychiatric, employment, and more. Group counseling. This form of treatment includes therapeutic settings use group therapy to capitalize on the social reinforcement offered by peer discussion and to help prevent drug-free lifestyles. Principles of cognitive behavioral therapy or contingency management positive outcomes are achieved. Researchers are testing conditions in which group therapy can be standardized and made more community friendly. Some examples of group counseling are psychotherapy groups, cognitive therapy groups, dynamic group therapy, relapse prevention groups, mutual self-help groups, network therapy. There are more, but these are some of the ones I've listed. DARE program. What is it? It is an acronym that stands for Drug Abuse Resistance Education. It was developed in 1983 by law enforcement and school officials. And what is their purpose? It is designed to teach youth drug information, decrease substance abuse as well, gives kids the tools they need to avoid drugs, gangs, and violence. Some response to the program is that 40% have said that they are not influenced by the program, and 70% had neutral to negative feelings about the program leaders. Some facts about the program is that it has proven to be successful, so the program has been involved in over 50 countries. So it probably means that it's been doing really well. But there has some been videos about it being not effective, and some studies saying that it's not effective as well. But it says that they're doing great. The duration of the program is usually brought to them in school, from kindergarten to the end of their 12th grade. For the last two slides, this is the references that we use for our presentation.